Hi everyone. So for today's presentation, I'll be discussing the significance of ageism in healthcare and its implications for older adults. But before we get started, let's start off with introductions first. So my name is Elisha Liu, and currently I'm a rising junior at Apokunung High School, and several of my extracurriculars include being a co-founder of STEM Seniors, which is a passion project dedicated towards improving senior well-being through STEM-based workshops, collaborations with other organizations and initiatives, alongside social media advocacy. Furthermore, I'm also a team representative for Girl Scouts of the Chesapeake Bay, and I'm also involved in youth and government and Model United Nations. And as a result of these extracurriculars, I've earned several awards, such as the Governor's Youth Service Award and the Girl Scout Torch Award. And finally, in the near future, I plan to pursue public health and/or neuroscience. So as we get started, here's a question to consider. What is one hidden issue that you believe is affecting a patient's quality of treatment in the healthcare industry? Well, your answers might be along the lines of race, economic instability, gender, and the lack of education. And yes, these factors are quite influential. However, there's another factor that you may not have thought of, and that factor is age, or in other words, ageism. In fact, ageism can be defined as a condoned stereotypes, discrimination, and prejudice regarding the elderly, old age, and aging processes. And ageism is actually quite commonplace in society, as according to the World Health Organization, or WHO, every second person in the world is believed to hold ageist attitudes. Furthermore, in a conducted research study, a total of 1,915 adults, or 93.4% of the study population, ages 50 to 80 years reported regularly experiencing at least 1 to 10 forms of everyday ageism. Now, this just demonstrates that ageism is a common accepted social issue. However, this also raises several questions. If it's so common, what does that look like in the field of healthcare, and how does that impact the quality of treatment that an elderly receives? Well, ageism can be apparent in many different forms, and as such, that can be apparent with the interactions of the elderly. And as such, that could be where they use inappropriate language and/or a violent approach, and to clarify, that could look like condescending and childish tones, being yelled at, treated rudely, disrespected, devalued, and labeled to be uncooperative and unintelligent. And as a result, this has an impact on the diagnosis, as unclear communication will inhibit older adults to participate, thus affecting the diagnosis. Furthermore, there's also the issues of attitudes toward the elderly, such as anti-aging behaviors or beliefs and stereotypes, which impacts patient well-being and resources, as healthcare professionals may unknowingly discriminate and elderly face less resources to receive the necessary help. And speaking along the line of resources, in fact, due to ageism itself, there are decreased resources or opportunities for the elderly to utilize, such as the decreased healthcare opportunities, and as such, it could be the restricted access to treatments, reduced surgical procedures, and less opportunities for health services and resources. As a result, this impacts overall life quality, as without these resources, they may not have the necessary time or resources and energy to sustain their life quality. And furthermore, there's also lack of representation in research, where the elderly are less likely to participate in clinical trials, which decreases the representation of the elderly themselves, and thus this inhibits potential treatment developments for the elderly, as much more focus is on the younger populations rather than the elderly itself. And now, looking at this overall issue from a broader scope, ageism in fact has a big impact on the elderly population, as it can contribute to cognitive decline, more hospital stays, disability, worse health, and worse quality of life alongside depression. Now, besides its impact on the elderly population, there's also an impact on overall society. In fact, the cost of ageism is $63 billion a year in the healthcare system. Furthermore, 17.04 million cases of the 8 most expensive health conditions in the United States can be attributed to ageism. Now, this just demonstrates that so much is being caused that with ageism, if this issue was mitigated, then so much could have been prevented or saved. And now, if we look at this issue from another perspective, it is found to be that ageism is much more amplified than one would think, as the United States is only classified as a less ageist country, and there are so many more countries out there that have high ageist or moderate ageist countries. And if we look at this from a long-term scale, from aging populations, It is quite concerning too, as according to the World Health Organization, between 2015 and 2050, the proportion of the world's population over 60 years will nearly double from 12% to 22%. And it can be told seen in the graphic above, where it's 2012, just a few years before, from 2015 and 2050, and you can see the drastic change in the number of elderly populations of those 60 years and older, with the red and pink representing over 25 or 30% and over of that country's population. And thus this just amplifies the issue, as if so much of the world's population cannot be properly cared for due to significant factors such as ageism, then what will happen to global health itself? However, there is also hope for this issue, as this issue or ageism can be mitigated, and as such, that could be done through education and training. For instance, the training of healthcare institutions amongst their treatments towards elderly with healthcare professionals, and there could be also policy and legal reform where healthcare institutions could ensure equitable access to healthcare quality by promoting age-inclusive policies and laws. And for instance, that could include more inclusive representation in clinical research. And finally, there's also the aspect of intergenerational collaboration, where older adults could have age-friendly healthcare systems which embrace their autonomy, but also integrating caregivers and providers who specialize in their care. And these are my sources. And I would like to acknowledge and thank you to my parents for supporting my endeavors, and to the Global Health Leaders Conference team for the opportunity to share my passions with this presentation. Thank you.